Well, joining me now, Professor Rijo M. He's a health economist based out of Kerala. Professor Gautam Menon, Professor of Physics and Biology at Ashoka University, is also with us. Thank you both for your time here. I want to begin by asking you, Professor Rijo, a Sero survey that has been done, the fourth one in fact by the ICMR, seems to be suggesting that as far as the state of Kerala is concerned, there is the least amount of underreporting in this particular state along with Maharashtra. What are your comments on the findings of that particular Sero survey?
Yes, Sneha, thank you for having me on your show. What you said is right. The Sero survey clearly shows that, Kerala's Sero prevalence is only 44.4% compared to the national average of 67%. And, how we estimate this undercounting factor is, you look at the date on which this survey was concluded, and you can actually see, the actual reported cases by each of these states. There are 21 states in which this survey was conducted. Mm-hmm. So based on the Sero prevalence at that time, you can actually have an estimate of what should have been the actual number of cases that should have been reported by the states. And then you compare that with the actual reported cases. And you can actually see, when you do that exercise for 21 states, you can see that Kerala was able to, through its testing and tracing and tracking, the state was able to record 1 in every 6 expected cases versus, states like Bihar and Uttar Pradesh, which were, Bihar, for example, was the worst in the sense that, it was able to detect through its testing only 1 out of 134 cases that was expected to have happened on that date. Mm-hmm. And it was 100 for UP and a wide range for other states. Even overall at India level, 1 in every 33 cases was only been identified as on the date of conclusion of the Sero survey. Mm-hmm. So it's clear that the kind of smart testing strategy or the tracing and tracking or more targeted testing that Kerala was able to do, and even to an extent Maharashtra, made it possible for these states to detect more cases for each expected case.
Okay, but Professor Menon, the Sero survey by itself is not extremely representative in nature. It just has about 70 districts of the more than 700 that we have in the country. This sort of an extrapolation then to say that Kerala is detecting better or Maharashtra is detecting better, is there some sort of a flaw in the method?
No, these Sero surveys are based on well-founded statistical methods, and the Sero survey has a coverage of about 21 states. But as you mentioned out, 70 districts in 21 states and compared out of the 740. So there certainly are districts about which we don't have enough information. But if chosen correctly, the mix of rural and urban districts in this mix of 70 districts that were studied should be fairly representative. It doesn't help us make very local, very specific suggestions for what should be policy in one district versus the other unless we have that information. But it certainly should be broadly representative of what's happening in India.
All right. Now, talking about Kerala, a lot of conversation online, offline about this flawed Kerala model that everybody is talking about. Professor Menon, you think it is extremely unfair given the fact that the state is testing more, detecting cases better, and most importantly, keeping the fatality rate low?
Yes, that's right. And the question is, what do you think, how do you define success in epidemiological terms when you deal with a disease like this? So let me list a couple of points for you. First of all, Kerala has the smallest fraction of people infected of any state. It has a seropositivity lower than any other state. So that suggests that it has managed to control the disease fairly well. It has, along with that, it has had a speedy progress of vaccinations. Over 20% of its population is fully vaccinated, and close to 40% has at least received a single jab. That's again a positive. You have, as you pointed out, the fewest fraction of people dying as a result of the disease. The case fatality ratio is about 0.5 as opposed to 1.3 nationally. It's testing well. It's testing well above similar states at 150,000 per day to 190,000 per day. Its health infrastructure has not been overburdened, and that's very important. It's producing relatively trustworthy data for public policy measures. That's again something significant in terms of being able to suggest to the government what it should do and what it should not do. And by and large, the measures taken by the government have been adhered to. So all of these are positive from the point of view of epidemiology, from the point of view of public policy. So I can't see why anyone would think of Kerala as a failure.
You know, Professor Rijo John, do you at one point agree with the central government? I say the central government because the Union Health Secretary has written a letter to the Kerala government saying that there were super spreader events, things that could have been avoided. The Supreme Court has pulled up Kerala. What was the need to open up for Eid festivities? Do you think that that is one mistake that Kerala could have avoided?
Well, as a matter of fact, I was one of those persons who actually criticized the state government at that time when it decided to relax the 3 days during the Eid celebration, relax the lockdown restrictions for that 3 days.
Okay.
But, at the same time, I must also want to say that, if somebody suggests that the recent surge in cases is exclusively due to Eid relaxation, I would not agree with that, simply because Kerala had seen the current reversal of cases, meaning rising of these cases right now that we are witnessing from Kerala has actually started from June 24th itself, whereas the Eid was on July 21st, almost a month later.
Okay.
So it was a continuation of the trend. Of course, the relaxation during the Eid may have contributed to, increasing the pace of it a little bit, but that alone is not going to be blamed for the current rising cases. It has got to do with the fact that there is increased mobility on the one hand, and also the fact that Kerala has a much larger proportion of its population that is still susceptible to the virus, almost 50% of the population, which is much higher than anywhere else in the country.
Yes.
So in a sense, Kerala is actually doing a catching up game with the rest of the country.
Yes, I understand. Professor Menon, the center says, at least our sources that we talked to during, Mina conversations with, those in the Union Health Ministry, they have said that right now what Kerala is doing is that they're not containing the infection much as they should be doing. There should be many more restrictions. Of course, that has changed with the announcement of a lockdown, but should that have come in earlier, in your opinion?
Well, we could always say they should have done things earlier. That's certainly true. And I think I agree with Dr. Rijo John that certainly the relaxations around Eid, relaxations a little earlier around political activity for local body elections, all of these should have been done in a more careful manner.
Okay.
I hope in the oncoming Onam festivities will be much more toned down and much more reduced given the background of the pandemic in Kerala. So I think this is a time for caution on the part of the Kerala government. They should use closures, lockdowns very carefully and selectively, depending upon what the test positivity rate is in different locations.
All right.
And it's very important to reduce the number of cases, because the more cases there are, the more opportunity for spread. So test, track and isolate is very important at this point.
All right. Last word to Professor Rijo on what do you think should be the way forward for Kerala from here on?
Well, as Professor Menon rightly pointed out, I would think that, more rationalized policy on its lockdown. Currently the government has this policy of, alternative days, certain shops are allowed to open and alternative days they remain closed, etc. So these kind of, I think those are slightly irrational in nature, which are leading to more crowding during the days when these establishments are open. And the select lockdowns only on weekends, etc. I'm not a big fan of those. So the whole idea, as Professor Menon pointed out, should be to, decrease the crowding as much as possible, whatever it takes, So that is an area that the government needs to improve on. And on top of that, I would also like the government to be more transparent about its reporting of deaths across all the districts. I see that there are some inconsistencies in death reporting from different districts when you look at the district data carefully. So that is also an area that needs improvement at the moment. I guess that's it from me for now. Yeah.
All right. That in fact is one of the suggestions of the Union Health Ministry as well, as far as that letter of the Union Health Secretary is concerned, that count your deaths right and do it as per the protocol of the Ministry of Health. Thank you, Professor John. Thank you, Professor Menon, for joining us and sharing your perspective with us on that important story from Kerala. Well, that is